Hey guys, welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, double board certified facial plastic surgeon. And today we have a special guest, Luchana Ladner, who is my wife, our surgical nurse director, and now my two-time patient, right? We recently performed two surgeries. What did we do?
A brow lift and minimally invasive neck tightening.
Perfect. So today we're going to get really candid from the perspective of a wife married to a facial plastic surgeon who not only is my wife, not only is she our surgical nurse director that runs our surgery center, but also a patient. So a few questions for you. So first, when did you decide that you wanted to have facial plastic surgery?
15 years old.
Okay. And what prompted that decision?
No, my first procedure was rhinoplasty back in 2019 with you.
Yep.
And then I just noticed that my eyebrows were getting heavier. I looked tired, and I'm not tired.
That's right.
When I am tired, we have 3 kids, but I'm not tired.
Yeah. Yeah. And so, from my perspective, Luch, refer to Luchana as Luch or Lucci, she had kind of told me for years that she was interested in doing something about her eyelids. So what were you noticing in your own words with your eyelids and, kind of the asymmetry? It's just, tell her what you were seeing.
I had heavy brows. My eyelids were heavy, which is genetic. Thanks, Mom. Well, we did her brow, or I'm sorry, bluff too.
Yeah, upper and lower. Upper and lower, yeah.
Yeah.
Family physician.
Family physician.
That's right. Yeah. So you were noticing a lot of asymmetry, is that correct?
Asymmetry, heaviness in my brow, and yeah.
Yep. So the right eye, I think she was just in photos. What she told me was, photos. She didn't look like herself. She just looked like her right eye was always tired when she wasn't getting a full night of sleep, and then just didn't look awake.
Begged him for years.
Yeah. So, so after a little bit of convincing, I said, you know what? I think you're right. I think you are a very good candidate for the surgery. So we proceeded with the brow lift. And I think that brings up a very important point. It's a really easy knee-jerk reflex to just say, oh, you have eyelid droopiness or eyelid heaviness and some extra eyelid skin, so we're just going to do an upper blepharoplasty. And certainly for her, that would not have been the correct approach. That would have left her with a very hollowed out appearance. There's some celebrities recently that have had that same procedure, which was the incorrect procedure, makes them kind of look weird and different. So we like to do the brow lift, which I think obviously was the right decision. So being married to a facial plastic surgeon, did that make the decision process with either surgery, the rhinoplasty or the brow lift, did it make it harder, easier, no change?
Well, we were married when you did my nose.
That's true. Yeah, it's true. Yeah. Not even engaged yet, right?
No, it's my boyfriend.
Yeah. Okay.
You're my forever boyfriend.
Yeah. So that was a serious step now that I think about it.
Serious.
Yeah. So glad it went well.
Yeah.
Okay. So that really didn't enter in on the first surgery. How about this last one?
Oh, I
After
felt
being married for 5 years.
comfortable, confident, not nervous,
Okay.
and it was necessary.
All right. Consultation process obviously unique with us because we could just talk about it at home, right?
I had a kitchen consultation.
That's right. Yep. And with those kitchen conversations, when did you feel comfortable with the plan? Because you toyed around with, do I need my eyelid skin removed? We talked about that brow lift. When did you feel like that was the right decision?
Years ago.
Okay. All right. Moving on. Okay. So day of surgery, you're not just coming into surgery. You wake up and I'm there. I don't remember if we drove in together, if you came separately. Together. Okay. All right. So see, those are the things that husbands don't always remember, but being the husband and the surgeon. So we drive in together, right? What were your emotions at that point? Were you nervous? Were you excited? Were you just like, this is kind of strange? What was going through your head?
I was super excited. I think I was more nervous about the after with bruising and having kids at home and what their reaction would be. So I the night before I took home some gauze and a bandage and I wrapped my head up and I told the girls I was going to come home looking like this the next day. And so I think that helped ease my anxiety with the after, but
for sure.
No, super excited.
And when did you first kind of like the results, like what you were seeing, and know that this was a good decision?
The day I took the bandage off. So the next day, super excited. I was bruised, of course, but right away. This is a pretty immediate gratification.
Yep.
Yeah.
And how would you say it's changed your day-to-day life, your confidence? Realistically, like what has it done for you?
Amazing. I mean, I have friends that look at me and say, you look so much more awake. Your eyes are more open. Just more confidence overall. I can wear eyeliner.
That's a big deal.
I know.
Yeah.
Not today, but normally.
And something we hear very commonly, that can be the first sign that prompts people to make the consult is say, oh my gosh, I can't even put eyeliner on anymore. I think it's time for something.
Yeah, I had to hold my eye and let it dry.
Yeah.
Now I don't.
Well, especially on that right side.
Thanks.
Yeah.
Not anymore.
Well, that's what you told me. She's right. We have a lot of surgeon friends, whether it be male or female surgeons. What advice would you tell their spouses if they were considering, facial plastic surgery or cosmetic surgery in general? Good idea?
Great idea.
Yeah. Okay, so
I was in good hands.
You talk
Skilled
it out. You would sell it.
Skilled expert hands, double board certified.
Okay, yeah. But now their spouse is going to perform the surgery.
Yeah.
So do you research their spouse and say, I hope that,
Good luck.
Okay.
Or I just refer them to you.
Okay. All right. Perfect. And so from my own perspective, question for myself, introspective question is, what was it like operating on my own wife? Quite honestly, I think the first 5 minutes that I'm starting the surgery, it's a little bit surreal. It's a little bit strange. And then you just have to go into surgeon mode, tunnel mode, sort of robotic mode. I hate to say that, but I treat her just like I would any other patient. And quite honestly, anyone that comes into my office, whether it's during the consultation, postoperative care, or during the surgery, I visualize and just sort of pretend as if they were truly a family member, a sister, a brother, a father, a mother, and treat them that way. So I think that also makes it easier, because then when you truly are operating on your wife, right, it's kind of like, well, I kind of pretend that, I'm operating on a family member every day, all day. So that's how I approach it.
We had a pep talk in the car.
I don't remember
before
that.
surgery.
What did we say?
Oh man, I was like, you're gonna
See, I'm
take
getting
your
into trouble
time.
here.
I picked my team, took our time.
Yep.
But it's funny, like when we had a baby, I didn't care who was in the room.
Yeah.
But for some reason, it was like more personal.
Yeah.
I don't know.
Yeah, and I could see that. I think that brings up a good point because, I think a lot of people, it's an insecurity, no matter how minor or major it is.
Yeah.
And so I could definitely see that because it's like, well, now you're announcing to the world, the public, or wherever we allow to be in that room, right, to observe the surgery or assist with the surgery, kind of like insight into an insecurity. Versus having a child where it's like, well, no, this is like
You lose all modesty in there, out the window, gone.
But that's like the happiest, right? There's no insecurities there. You're just so happy to be having to bring a child into the world. Versus like, okay, I'm taking care of myself. I'm addressing something that's bothered me for a while. That becomes pretty personal.
And you were with me for all those moments.
That's exactly right. Yeah. All right. I think that's it. I think you guys saw that nice little candid interaction as my wife, my patient, and our surgical nurse director. Thanks for being here, Luchana. If you guys liked what you heard, please be sure to like the video and subscribe to our channel.